Hello, could you introduce yourself?
Yes, so I'm Michael Patterson. I'm a doctoral research fellow as part of the Transform team at Hull York Medical School. In my clinical role, I'm a nutrition support dietitian, also based locally in Hull.
And can you tell me a bit about why you chose to study the implementation science module?
I chose to study the module for a couple of reasons. So the first reason, it was an area that I didn't know a great deal about, but I sort of knew that I wanted to investigate a little bit more for my own studies. So in terms of my PhD, looking to implement some of my findings into practice and have a greater knowledge of how to implement it into practice. I also wanted to get a greater understanding from my clinical experience. So I've experienced how difficult it can be to get evidence-based practice into routine clinical practice.
And what do you feel you've gained from the module?
I think sort of from the module, because it was quite new to me, I've gained an understanding of some of the frameworks and theories that underpin implementation science, and also getting into sort of greater knowledge of the challenges of implementing sort of evidence-based practice into routine clinical practice.
And how do you think it will help you in your future career?
It's already started to help. So with the current climate, as part of my clinical role, we've actually been able to sort of improve our electronic working, being able to implement some of that into our routine practice currently. And I think sort of it'll help, especially in the future, with some of my own PhD research.
And finally, do you have any tips or advice for prospective students?
I think one of the big things is to sort of utilise the reading list. One of the things I would do is there's a few papers that have a good overview of what implementation science is. So it gives you sort of, for someone new coming into the area, a good understanding, just a brief description of the different areas and the different theories and frameworks. And sort of, if your role has anything to do with audit, research or service development, I think this module will sort of be extremely useful in gaining a good understanding of implementation science and allowing you to put that into your own research or into your own service development.
Great. Thank you very much for your time, Mike.
Not a problem. Thanks, Matt.